Hey everybody, Dr. Barron here with virtualheadachespecialist.com. I've gotten a lot of comments in the feed about Botox for chronic migraine, wanting to know more about that, so I want to just go over that today. We do a ton of Botox for chronic migraine, and I've seen it be a life changer for many patients. It's quite effective for most people that we see. So something to be on your radar if you're not making progress and you're still just living in misery with chronic migraine. The Botox has an interesting story in how it was developed for migraine. And initially, there was some evidence that patients would notice when they would go get their Botox cosmetically, mostly women for wrinkles or whatnot. They would notice that their migraines would improve significantly. We know that women have migraine much more commonly than men, and so many of them were getting these cosmetic treatments and were noticing this pattern. So eventually this led to trials looking at Botox for the treatment of chronic migraine, and this eventually led to a big trial called the Preempt trial, and I'll talk about that more in a bit. But this was the trial that in October of 2010 got Botox FDA approved for the treatment of chronic migraine. And really since 2010 on, Botox has been the only truly FDA approved treatment for chronic migraine. Up until the last couple of years, there's been some newer options that have also shown good evidence and actually have some approval for that. Different video for those things. But, it's a very effective option. It's something to be aware of. The mechanism of how it works, how I explain it to patients is that, in the nervous system, in the nerves, the way that pain transmits, you have nerves, billions of nerves that are lined up next to each other. And in between, there's a little space called the synapse. And so the way that nerves communicate pain is that they release from one end of the nerve, some chemicals, neurotransmitters, into that synapse. They go to the next nerve. They could basically continue the signal. So the way that Botox works, though, the way to think about it without going into details and making you fall asleep, is that the Botox prevents specific proteins from releasing those chemicals into the synapse. So essentially, you are disrupting that electrical communication of pain. You're stopping it. You're shutting it off. It also does cause the muscles to technically become paralyzed that you inject it into, so the muscles can also loosen up. If you have a lot of tightness in the shoulders, back of the head, those areas, that can be also effective by loosening those muscles up. But the main mechanism actually is that it disrupts the electrical signaling of pain. The procedure of Botox, for the best outcome, you want to make sure you have somebody that does a lot of Botox. Very experienced, preferably a headache specialist that does a lot of them. We see a lot of patterns out there that are just kind of done randomly, quickly, not strategically placed. Strategical placement is key for getting good effect with Botox. For example, patients often will have occipital nerve irritation and tenderness in the back of the head, so I like to give extra over those nerves. Targeting the specific nerves through the head and the scalp is key at getting the best response. You don't have to go very deep. It's just right under the skin is actually the target where the sensory nerves are traveling. If you're going way too deep, hitting the bone, some people just go way too deep and they're not going to get the full effect of what you should be getting. Personally, I like to rub in the little spots. It's a very small amount that's dosed. And the more little nerve endings we get to, the better effect you're going to get. So that's how I like to do it. And you want to make sure you have somebody that does a lot of it. I have a lot of patients that fly out of state, across the country. They'll come in for a 20-minute Botox and fly home. It's crazy. But technique, experience is key at getting the best response. A lot of my patients won't see anyone else for Botox even, in our facility, just based on experience and and the response that they get. So it's key is getting somebody that does a lot of it. The procedure itself, it's about 30 to 40 spots. I know it sounds like torture. It's not as bad as it sounds. It's a teeny short little needle, just a little prick under the skin. And it just takes a few minutes to do. I have my patients lie down for the majority of it. The second half, we'll have them sit up and do some in the back and the shoulders. And the positioning of these spots is basically across the forehead. There's 3 in the middle here. Through the temples, about 5 on each side. The back of the head, there's about 8 along the base of the skull, over those occipital nerves as well, and then about 10 through the shoulders roughly. And it comes out to between 30-40 spots. I usually tend to do the full dosing of about 200 units, which usually is about 40 spots. Side effects, the nice thing about Botox is that it's such a low side effect treatment compared to a lot of pills that have these nasty side effects. I've done thousands and thousands of Botox. I've never seen one bad reaction to it. So that's a nice thing about Botox. If you do it right and do it in the right spots, you shouldn't expect to run into any side effects. But what I do like to tell people is that some side effects that are potential things to be aware of is that you could have some tenderness in the spot, you know, for part of the day, maybe a little sore. Usually not a big thing people complain of. Droopiness of the eyelids has been reported. I have never seen that happen, but if you do it too low, you could get some asymmetry of the forehead muscles. Sometimes people get like the Spock looking appearance. It just means that they're not doing it in the right spot. A little too low, a little, you know, too far over. Always a risk of infection anytime you pierce the skin. I've never seen that happen. We swab it with alcohol, but still if it's turning red or swelling, I tell people to let me know, obviously. And ultimately, people say it's well worth the temporary discomfort that they get. Like I said, I've seen it be a life changer for some people, you know, just miserable chronic migraine 30 days a month, you know, going down to, you know, sometimes 0 days of headache a month. So it's a really effective treatment for a lot of patients. Just like everything, not everybody's going to respond to it, but at least from what I see, the majority do very well with it. And then the duration of the effect is about 3 months, which is nice. So 4 treatments a year, and a lot of times maybe a week or 2 before you get to that 3-month mark, it starts to wear off. But if you are coming in at 3 months, you're not starting to notice an increase in headaches as you're getting close to that 3 months, then I usually tell people let's try to push it 4 months. And if they're coming in at 4 months and the headaches are not getting that bad as it wears off, I usually just say let's stop it. You know, my goal with any treatment is eventually to get rid of as much as we can once the neurological, the electrical system is kind of reset with a treatment that we've been using. And, you know, because anything after 3 months is basically you doing that yourself. So you may not need it if you're consistently doing well. I do have some people that can go 4 months consistently before it wears off. It's not common, but I do have a few like that. But generally speaking, if you're getting into 4 months without bad migraines popping back up, I tend to try to just stop it for a while. You can always restart it if you need to, if it comes back again. So, you know, those are the key things I just wanted to highlight. Again, I can't emphasize enough the point of if you're going to get the Botox, you want to make sure it's with the right person that does a lot of Botox, is very experienced in how to strategically place the Botox, where to place it, you know, how to target different nerve areas better depending on the physical examination. And you know, that's really, I think, one of the keys to getting a good response with it. So you want to just look into your injector, make sure they do a lot of it and they know what they're doing. So the pattern, again, is called the preempt protocol. I tend to use a full 200 units. The trial for the preempt was 155 to 195 units. They come in 100 unit vials. I tend to just use the whole 200 units because, you know, I think the more spots, the more sensory nerve endings that you can suppress, the better effect you're going to get. That's my anecdotal experience, at least. So if you guys have any questions, feel free to drop them in the feed. Hopefully I hit most of what I wanted to hit today, but I'm sure there's questions out there. So feel free to drop them in there if you have questions, and I will get to them eventually. Okay, guys, bye.